a little bit about the folks who work at Hurley. Actually, how many employees are at Hurley Medical Center?
We have about 2,500 employees at Hurley.
That's wonderful, because I know that a lot of times you ask somebody in this area where they work, and if it wasn't GM, it was Hurley. So I mean, Hurley really is very crucial in the economic fabric of our community here.
And not just the people who are employed, but also the people who are retirees. And also, we try as best we can to use local resources. Hurley, we're very focused on building a new emergency room. That will be a $30 million project. There will be $18 million in construction. And we expect that $18 million is going to stay local as we go forward and construct that new addition to our facility. And we have contracts with many local vendors for a whole variety of different services. So, you know, we try to be good local citizens in that regard as well.
Now, where do people go to find out? I'm just thinking about people who are listening to our broadcast today and hearing these incredible numbers that you employ as many people at the medical center as our larger General Motors facilities here, that there are ways to move from housekeeping up and janitorial staff up into the actual medical profession. Is there a place where people are able to inquire about job opportunities at Hurley Medical Center?
Well, they can do two things. If they're internet savvy, they can go to our website, which is hurleymc.com, or they can stop by our human resource department. We also regularly have health fairs at the hospital, where not only do we describe hospital programs, but also connect with local universities and colleges that offer specialized training. And we have, as I said, dozens and dozens and hundreds of students who are at Hurley at any given time. And any of them would be happy to go out and speak to classes and in high schools to convey to them what the range of jobs are. There are literally hundreds of jobs in healthcare. You don't have to be a doctor or a nurse. We even hire people that have their high-pressure steam license. You know, a big facility like Hurley needs the best in engineering as well. So there's a whole variety of jobs at places like Hurley, and we hope that we're always going to be a source of jobs for the community.
Time is really flying this morning. We're already at that point where we pause for our inspirational break. And don't forget, when we come back, we are open to taking your calls at 239-5733. And our song selection recently has really been about praising God despite your circumstances, despite what's going on. But also, as his kids, it's good to know that he actually does care about what's going on with us. And we're going to begin to focus a little bit more on imploring him and acknowledging our need for him as we move forward.
Yes.
We're back with you and Dane. So tell us some of the more technical aspects of this millage. I know you said that it's 0.9 mils. So what does that mean for the average taxpayer? Also tell us, how long are you asking for folks to pay this mill, and what really are the consequences if it doesn't pass?
Well, for the average homeowner in the county with a home valued at $125,000, it would be about $55 a year, which is about $1.08 a week. And of course, in the city of Flint, the valuations are lower than that, so it would be a fraction of that. Hurley has been the kind of hospital that has always put community service up as an extremely high priority, and the investments we make are really in care more than it is in programs that throw off profit. So currently Hurley loses a significant amount of money on its programs to care for the poor and the safety net clinical services I described. You know, until recently, Hurley was losing over $7 million a year. It's only in the last 2 years that we've really begun to turn that around. So Hurley has lacked an underlying financial stability. And we're one of the only public hospitals in the whole country that doesn't receive any funding whatsoever from the federal, state, or local governments in terms of grants or millages. So this is an unusual situation, a very unusual situation that we receive no funding at all. What would happen if the millage is not successful? It will be very difficult for us to make continued investments. We've had what amounts to about a $21 million financial turnaround in the last few years. Frankly, there's not a lot of opportunity for further cost changes. Hurley did that while at the same time improving our quality scores, our patient satisfaction scores, our employee scores, and increasing our nursing. But it's going to be very difficult for us, especially in this terrible economic downturn that we're confronted with, for us to continue to make the kind of investments that the broader Genesee County community really needs.
Well, I thank you for that real honest assessment of what this very small amount of money per household, what it can do, because the medical center should be rewarded for the hard work that it's done these recent years to do everything it can. You've balanced the books, you're doing more with less, and it's time to see this medical center go up a notch, and that's what you're proposing. I mean, these funds will help you with the work with the youngest children, with the emergency room, and I also know that you have some very exciting plans for the neighborhood immediately surrounding the medical center, and have some assets there that you want to be able to continue to develop. When I think about what we want that University Avenue corridor from University of Michigan Flint, right there on the edge of Saginaw Street, all the way over to Mont Park and Kettering University to be, between Atwood and the medical center, you're right there in the middle of it. So I want to make sure that the listeners know some of the great plans that you have for Flint's neighborhoods, in addition to all the things you're able to do with the medical care.
Well, in the last few years, it's been so important for us to focus on our financial health and on community well-being. But we did, through a Mott Foundation grant, do a study in collaboration with the Carrottstown community that pointed to certain real opportunities in that area. Hurley and the Land Bank control an entire block from Atwood Stadium up to Fifth Avenue. And we've approached employees working downtown at Hurley and at Kettering about their level of interest in having a walkable commute. And there was very significant interest, and there's a design that's been put together through Metropolitan Housing for 43 houses on that property. This is formerly an abandoned nursing home that was torn down, and a couple of houses and a parking lot for Hurley. And what we're looking to do there, as we are along the property that we've assembled from tearing down 50 houses in the East Hurley neighborhood, to create a property that can be used over the next several years for new housing. We very much want to create density along Grand Traverse and Fifth, and we also want to provide opportunities for commercial development of that area as well.
I think many people remember what that corridor was like back through the years. I'm only 35, so I don't have as long of a memory as some do, but my family and I, we went out to 3rd Avenue Fish and Chips and went out to all kinds of games there at Atwood, and we're starting to see more activity there, and it sounds like Hurley is right in the middle of some of the momentum as that community right in those immediate neighborhoods is able to move forward. It sure would be wonderful to drive down that corridor and have to stay stopped at a traffic light for some extra time while employees from Hurley were rushing from their homes into work, because it was a walkable neighborhood and people were living and working and shopping and going to these other stores all right there in the neighborhood.